you see here, they will all be misshapen because they've been sitting in the bottom of buckets, etc., with all the rest of the material resting on them, so they are all deformed. But still, know these structures, and then you look for them in the real hearts. So just to give orientation here, you got a diaphragm right here. This is part of the liver. The vertebrae is back here. Okay. So first thing you look for with these ones, as well as with the real hearts, this item. That's your pulmonary trunk. We start with the pulmonary trunk. That tells you you're looking at the front of the heart. You can't see the pulmonary trunk from the back. And also, as far as all the illustrations are in your textbook, not so much the atlas. The atlas is still tilted close to how it should be, and kind of like this one is kind of how the heart should be on you. Okay, it's not supposed to be like this one, going straight up and down like that with the apex pointing down. Okay, so you got the flat side of it. That's the diaphragmatic surface of the heart. Very often when we say the back of the heart, that is the part of the heart that we're talking about, the inferior surface of the heart. So from the anterior view, once you have the pulmonary trunk, to its right you have the ascending aorta. To the right of that you have the superior vena cava, and that's going to lead you right down into the right atrium. Okay, so here's the right atrium. Best thing to go through the heart structures is to follow how blood is going to be going through it. Okay, so this one is supposed to have the pectinate muscles, and these don't quite look like how they should look on the real thing. On the real thing, these bundles of heart muscles would be more or less parallel in bundles. Okay, pectinate means comb-like, as if somebody just ran a comb through them. So, and then you look for the 4 openings in the right atrium. You have an opening for the superior vena cava, one for the inferior vena cava, and then there should be one for the coronary sinus. That one should be right about here, but they put it over there. Okay. And then you have the tricuspid valve. So those are the major things you look for. And there's one other item you want to look for. We have maybe 3 hearts that actually have this still intact, and that would be the fossa ovalis. Okay, that's a thin, very thin part of the interatrial septum, and that part would be just about the thickness of the glove. Okay, so after that you come into the right ventricle. Okay, so again you want to look at the right ventricle almost like an inverted funnel. Okay, so the cup would be down there and the stem would be up here. So down there you would see your papillary muscles, and there should be 3 sets of them, not just 3 but 3 sets of them, and those sets would have the chordae tendineae attached, going from the papillary muscles to the cusps of the tricuspid valve. Okay, and then the interlacing bundles of cardiac muscles here, those would be the trabeculae carneae. And on this one, they only drew it in. They didn't exactly leave it sitting out. But we have two hearts that actually clearly show the moderator band, also known as the septomarginal trabeculae. So what they're showing is those white things. Those are the conducting muscles. That's going to lead the impulse over to the papillary muscles, getting the papillary muscles to contract a split second before the apex. Okay, so interventricular septum is right along here. And then if you can visualize these, and most of these charts don't really show it very well at all. If this were three-dimensional here, then this part would be very much look very much like an arch. So that would be the conus arteriosus. So the conus arteriosus is what's going to be guiding the blood into the pulmonary trunk. And when the blood is going to be coming up here to go through the pulmonary valves. Okay, there should be 3 of them. And then through that, once the blood is up here, they would then continue onto the pulmonary arteries, and these ones would go to the lungs. And then pulmonary veins should be red, but these guys probably run out of red paint or something. So the left atrium would always look very much like what you have on these ones, like a rectangular box sitting in the back. Okay, so it's not like what they show you in your textbook. Okay, it should be very much like a rectangular box, and ultimately there would be 4 of these pulmonary veins heading back into the left atrium. So you would have 2 openings on each side of it. So left atrium would have a sum total of 5 openings. Okay, 4 of these for the pulmonary veins, and then you have the one for the bicuspid valve. That's this one. Okay, bicuspid because
could you point to the bicuspid valve again?
2 cusps, and then you have 2 sets of the papillary muscles with the chordae tendineae, and the left ventricle is going to have the wall as thick as what you have on the interventricular septum. Okay. And you also have trabecular cardia here. You would have your papillary muscles, and then this would be the aortic valve. So once you come through that, you'll be going up the ascending aorta, and this would be the top of the ascending aorta. That would be your aortic arch. So I'm putting this back in so we can still be able to find the coronary arteries and the branches. Okay, so you're going to get your right coronary artery. That's what this is. It will be coming out of the base of the aorta. And then there should be a left, and the left coronary is the one that's going to be traveling behind the pulmonary trunk. So for the right, it will continue here as the marginal, right marginal, and then it'll continue around to the back, and it becomes one of these in the back. Coming around and give off the posterior interventricular artery. Posterior interventricular artery here. And then for the left, as soon as it clears the pulmonary trunk, it's going to send down the anterior interventricular artery, that's this one, and it'll continue around as a circumflex artery. anything you see that's red going around, that's the circumflex. So some other things to look for is this very large vein back here. That's the coronary sinus. That's the ultimate drain for the major veins that would be draining the heart wall. And when it gets to here, that's where you should be looking for that opening for the coronary sinus. The orifice of the coronary sinus would be right above the entrance of the inferior vena cava. So look for those things, okay? And then this would be the pulmonary trunk. This is the left common carotid, left subclavian. And then this is going to come to the anterior left of the bodies of the vertebrae in here. And then all these little knobs, those are the branches going to the ribs. Those would be the intercostal arteries. And this particular white item is the vagus nerve. And also you can now appreciate just how close to the aorta the esophagus is. So if you swallow something very large, that big bolus going down here can press up against the aorta, and that can cause some back pressure, so you might get some erratic, couple of erratic beats from your heart also.
You ready?
Don't eat. Stop that. Stop.